It is my great pleasure to share with you guys a unique coalition that's formed right here in the River Region to increase access to healthcare. The River Region is a 5-county area that is working with professionals from all different careers to solve the problem of healthcare delivery. To put this work into context, Envision 2020, the neutral convener in the River Region, which is a planning entity for the River Region, was approached in 2007 by business leaders, elected officials, and the hospitals to fix healthcare. Well, the director of Envision 2020 said, I had penciled in world peace for the upcoming year, but I guess I can fix healthcare. So she thought about it and said to herself, maybe I can hold some bake sales to possibly help the hospitals recoup their losses. But then she thought, that probably won't be sustainable. So she then engaged healthcare management associates who conducted a study, which yielded 75 recommendations falling into 5 broad categories. Those categories are finance, access to care, information technology, research and education, and recruitment and retention of healthcare professionals. They all had the same mission, which is a medical home for all in the River Region. Now, the most significant barrier to quality care in the region was recruitment and retention of healthcare professionals. In order to address this barrier, we determined that we needed to focus on the physician, because without the head of the medical team, you have no team. Hence, MD Connection, where you're treated well, was born. Because our physicians treat us well, we want to treat them well. So let me provide you with some national facts. Nationally, we have 1 primary care physician for every 3,000 patients. And in the River Region, we have 1 primary care physician for every 4,000 residents. Well, sorry, for every 4,000 patients. We also have an insufficient number of primary care physicians who are able to accept the uninsured, underinsured, Medicaid, and Medicare patients. Also, our specialists, they'll care for this population while they're hospitalized, but they can only provide 1 post-hospitalization visit. These individuals also have limited access to specialized care in the ER because some specialists, they're not available for on-call care. And because of the economy, we have an exacerbating problem with the job losses that these families are facing. So these individuals access our ERs for their care that they could receive in a medical home, which is 5 times more expensive. And it also results in less continuity of care. Lastly, I'm going to give you a statistic that applies here to the River Region. Our average age of physicians here is in the mid-50s. We would like for it to be in the mid-40s. So what is the solution? A unique coalition called MD Connection. It's a partnership between the businesses, elected officials, schools, and our medical community. Now, what makes this so unique? Well, you might see in other communities the schools partnering with the medical community. That's not unique. What makes this program so unique is that our elected officials have become so involved in this whole process, along with our business community. And these individuals understand that we're not just recruiting a physician, but we're recruiting the entire family, specifically the spouse. Because, get this, the spouse is making 80% of the decisions on where they're going to locate. That's a big decision. So, if that spouse is not happy, then the physician will ultimately not stay in the community. Therefore, retention is embedded in the recruitment process. So this coalition has partnered with us to help fast-track the employment process. And just to give you guys a few key examples, several of the physician spouses who we have assisted with gaining employment for, they've been pharmacists, engineers, a science teacher. That's just a few key examples. The business community specifically understands the return on investment in supporting this entire program because they understand that physicians contribute to our local economy. A family physician contributes $770,000 annually, directly and indirectly, to this economy. Specialists have an annual base economic impact of $2.6 million. And indirectly, physicians help sustain a healthy workforce, and they positively impact the quality of life in which the communities in which they live. So we've talked about our business community and how they're assisting us. Now let's talk about our schools. And our partnerships with our schools are not only with our public schools, but also with our private schools. And they're contributing to our momentum that we have. Research indicates that physicians are more likely to return within 70 miles of where they practiced and trained. So we have started our coalition with the high schools. And we're working with our high schools starting in 10th and 11th grade and developing those relationships and really mentoring those students. And then moving on to the pre-med students and allowing them to interface and develop those relationships with the medical school admissions committees and fostering those relationships. And here in our community in Montgomery, we now have our new medical campus, which we've been interfacing with that program, which is a partnership between UAB and Baptist Medical Center. We also have a partnership with our two residency programs, and we've been working to recruit and retain the best and brightest medical students and residents in both of those programs. So recruitment. We work with recruiters at the hospitals, private practices, federally qualified health centers, because they are selling their entity. So we work with them as a coalition to sell the river region. And top leaders in the river region understand and are uniquely involved in this process because they know that they need to befriend these physicians and the families in order to have a leg up on the other communities that we're competing with. So our partnerships with our elected officials is very unique and allows us to stand apart. An example of this in action is when our mayor here in Montgomery met with a prospective physician and his family, and he was able to sell this family in a personal way by articulating his vision for our city and was able to sell them on our unique aspects here of Montgomery. And it's these unique relationships that allow our coalition and our program to be so effective. I'm going to leave you guys with one last statistic. I know I've provided many statistics now this evening, but I'm going to leave you with one. Physicians coming out of their residency program have 100 job opportunities. That's a lot. I'm going to leave you with now a question and our answer. Why would a physician with over 100 job opportunities move to the river region? Our answer, because we treat you well. Thank you.